Hello, good evening, Namaskar. I am Dr. Rohan Krishnan, and you are watching Medical Dialogues Presents The Health Perspective. In today's episode of Health Perspective, we are going to discuss about the most serious topic of this decade, at least, that is the COVID pandemic and the effects of the COVID pandemic. To speak with us on this topic, I am pleased to welcome Shri Dr. Suresh Kumar sir, who is the HOD Medicine Senior Consultant Physician, Medical Director, Lok Nayak Hospital, Maulana Azad Medical College, New Delhi. He possesses degrees such as MD, FICP, FRCP. He was the head of COVID Task Force and Chief Center of Excellence Viral Hepatitis, Maulana Azad Medical College, New Delhi. He has 31-year-old experience, visited more than 20 countries, more than 50 research publications, written a book on clinical management of COVID in India, and he is a well-known towering personality of this medical fraternity of at least this decade. Everybody knows him, everybody wants to listen to him. I'm very thankful for sir to taking out his time from this busy schedule and telling us about the post COVID illnesses which we can expect in the community. Thank you so much for joining, sir.
Thank you, Krishnan. Thank you for kind words.
Yes, sir. Sir, the stage is yours, sir. Whatever you want to tell our viewers, the 5 lakh people which will be watching these videos regarding the post-COVID illnesses, how to prevent them, how to when to act, when one should get alerted that okay, something is there. Please, sir.
Uh, First of all, I just want to give you the congratulations that you are touching a very important public health problem, uh, COVID and post-COVID illnesses. And we every day see the number of untimely death. We know that COVID cases are at the bottom. We have the positivity rate in the country is less than 1% now, and even less than 0.5%. And we have seen that although the number of new cases are negligible, but the problem of post-COVID continue to keep the physicians, chest specialists, and the pulmonary physicians busy. And every time in the emergency, we have the untimely cardiac events, cerebral vascular accidents, thromboembolic phenomenon, various other complications, multi-system involvement. Why this is happening? Is it because of the uh, natural history of this virus or because of something else? So in this next 10 minutes, we are going to analyze why it is happening, what is pathophysiology, what are the long-term complications, and how we can recognize these events at early phase so that we can prevent the premature deaths in these patients. Now, if you see the last 2-3 months, we have heard that a large number of young patients are dying prematurely because of the coronary events, acute MI. This is because of the uh, hypercoagulate at one hand, and you have the patient's complication because of their age, because of their obesity, because of their multiple factors, like whether the patient have any immunocompromised state, or patient have chronic kidney disease, or patient have some behavioral problem like IV drug abusers. We have seen that many patients are coming to the OPD and to the emergency because of various post-COVID problems. Now, what are these common problems and what are uncommon problems? Common post-COVID problems which we see in our clinical practice is the body ache, weakness, uh, inability to concentrate on the work, nausea, problem with the smell, problem with the behavioral problems. So if you just look at the system wise, you can have the cardiovascular problems caused by long COVID or post COVID. These cardiovascular problems are high blood pressure, myocarditis, pericarditis, coronary artery disease, and you have the poor LV functions, diastolic dysfunctions, and you can have the cardiac failure in some patients. who already had the underlying disease like diabetes or the other problems. So apart from cardiovascular problem, you can have the pulmonary complications. These are the persistent cough, chronic cough which persists for more than 2 months, and patient have an ability to have a good sleep because of the continuous cough. So you have the respiratory problems. Then major respiratory problem is the in the pulmonary circulation because of the pulmonary thromboembolism, and you can have the breathlessness, you can have sudden deaths. Then you have the problem in the GI system. You can have the nausea, vomiting, you can have the liver dysfunction, you can have the persistent rise in the SGOTPT, you can have the even the persistent vomiting and anorexia because of the liver problems. Then you can have more problem in those patients who have the liver fibrosis or the fatty liver. Then you can have the problem in the pancreas. We have seen many patients who are admitted in the medicine ward post COVID because of the pancreatitis. So this virus not only involves the respiratory system, but it affects the multiple organs, vital organs. So pancreatitis is also seen in these patients. Then you can have the problem in the kidney. You can have a problem in the even in the female patient. You can have the menstrual problems. We have seen many patients with the uh, post-COVID menstrual problems. Then you can have hematological problems like anemia is seen in many patients because of their poor appetite. So these patients can have the multiple deficiencies, and anemia is also seen nowadays. Then you have the behavioral problems like forgetfulness, you can have the dizziness, you can have the vertigo, you can have other CNS involvement, you can have in the serious patients, you can have even encephalitis, and you can have the Guillain-Barré syndrome. So all these problems nowadays we see, and above all, we do see patients who have received the vaccine. So nowadays, a lot of patient come that I have received this vaccine, and post vaccination he was asymptomatic earlier, but after vaccination they have the uh, COVID vaccination related problems are also seen in these patients.
Sir, we have
Yeah.
seen a sudden rise in the number of deaths of people who are going to gym. Can COVID have an effect on these people? We hear suddenly people who are going to gym or having some problem are having this issue.
Definitely, we have seen the correlation, and there are 2-3 studies in there after the vaccination and after the COVID. Most of these young patients, they have the because they were locked down and nobody was going to gym for last 2 year and 2.5 years. Suddenly, they are doing a lot of exercise. So the heavy exercise, heavy cardiac exercise is putting a lot of stress on the heart, and because of the myocardium involvement, because of the pericarditis, and because of the coronary events, they are prone for a sudden death. And this is well documented nowadays that these patients can have these complications. And some of the studies from the USA and from the European country have shown that even in the asymptomatic patient, asymptomatic COVID was there in few patients, and after the recovery, after the vaccine, these patients develop acute MI, stroke, and the complication caused by the various COVID vaccines. So this is well known.
Sir, so what should the youngsters and especially people of the age group more than 60 years should protect themselves and should get alarmed, like how much walking or how much physical exercise is acceptable for them to do?
Uh, because if you put the heart on a great risk in a shorter time and you do the very heavy exercise, it is not advisable. One must go for the brisk walking, and one must know the capacity, because if you do the exercise in a very small period and your stamina is not there, then it causes definitely a burden on your heart, and it can cause. So it's always better to go for the light exercise, and your blood sugar must be okay, because if your blood sugar is very high, you have metabolic problems, you have the hypertension, diabetes, and dyslipidemia. These people's and if you are smoker, then you are definitely at a higher risk of developing the cardiac events during exercise. We have seen many cases in the Delhi and NCR that suddenly we have surge in the number of cardiac events post COVID because of the very, very massive exercise. So this should not be the practice. One must do the light exercise. One must be first see that if you are having a problem with the exercise, you must immediately stop, and you must check your all the vital parameters before you go further heavy exercises. So as we recommend that most of these people who have the persistent uh, lung problems, fibrosis, if you have the other comorbidity, then you must not go for a very, very heavy exercise.
Sir, can obesity also be a comorbidity factor to increase such deaths and people with lifestyle which are lacking of physical exercise?
If we do the analysis of thousands of patients who had COVID, and we have seen that the 15%, 12 to 15% who have the obesity, they are much more at risk to develop the complications, and the severity of disease and the post-COVID complications were mainly seen in those patients who are overweight, who are having either other diseases also like diabetes or metabolic syndromes, or these patients, if you have the history of some substance abuse or smoking, then definitely it is seen in the most of these studies.
Sir, you have written a book regarding the COVID. Please tell our viewers about the name of the book and what is it about?
We have written a book, and most of these are the real world experience, because when the COVID pandemic struck the country, there were no protocols, there were no set guidelines. But now with the first wave, second wave, and then third wave, and the different variants you have seen that every time new variant have seen in our clinical practice. So we have combined all the clinical experience, like what happened, how these protocols were implemented, and what were the problems we faced, what were the oxygen crisis, and what are the long-term complications, what are the radiological manifestation. All these aspects were compiled in these books, and most of the chapters were written by the eminent faculty of Maulana Azad Medical College, GB Pant Cardiology Department, and experts. A few of the chapters were contributed by our colleagues from the All India Institute of Medical Science, ILBS, and from the Ram Manohar Lohia Hospital. So this book is available by the name of Clinical Management of COVID in India, and I think this is a very useful clinical bedside book. And we have seen that all our residents, all our doctors must go through the guidelines, what are the various aspects of COVID which are seen even in the post-COVID period. We have also written a chapter for the mucormycosis. Post-COVID mucormycosis was the major problem after the COVID, and we have two chapters on the post-COVID complications. So all aspects are covered in this book.
Thank you so much, sir, for joining us. I once again thank Dr. Suresh Kumar, sir, MD, LNJP Hospital and Maulana Azad Medical College, sir, for giving us time for our viewers. I thank him on behalf of Medical Dialogues as well. A very well-known personality in the medical fraternity of the country, and a real COVID hero who has managed the biggest trauma center of the COVID center. There's the trauma center which was established as the COVID center during the COVID pandemic, and was having the highest number of caseload in Delhi. I thank you once again, sir, for joining with us. Thank you so much.
Thank you. We have treated successfully 25,000 cases
Yes.
in the country,
Yes.
highest in the country. 25,000 cases were successfully treated, and we have conducted deliveries in 900 COVID positive mothers. And at the same time, we did a dialysis in the COVID patients. 3,400 dialysis were performed, and we received best COVID care centers and appreciation from the United Nations for COVID vaccination as well, because single center we had successfully done more than 1 lakh COVID vaccine doses in our center at Loknayak Hospital. It is because of the teamwork of all the young doctors like you who have contributed a great for the nation. And thank you once again for Medical Dialogue for giving me this opportunity. Thank you very much.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.